Good morning, friends. Myself, Dr. Vipul Gurjar. I am the head and professor of the surgery in Vadodara, as well as I am practicing surgeon in Vadodara. Today, I am going to discuss about the STAR procedure, that is the STARR, stapler anal rectal resection surgery, or you can say the double stapler surgery. This surgery and this discussion is about my experience. Do not consider as evidence because there may or may not support my sentences or the statement with the evidence, but I want to share my experience only. Why the STAR and what is STAR? This STAR procedure is invented by the Dr. Longo, Italian surgeon. He is also an innovator of MIPH. This surgery is mainly used for the excision of redundant mucosa or the partial rectal prolapse. Okay, first thing. Now, by the indication, he has introduced this technique for the obstructive defecation syndrome. This obstructive defecation syndrome is somewhat one different phenomena that is correlated with the piles itself nowadays. Because of this long redundant mucosa, these patients are feeling not able to evacuate properly. So, Sir has innovated the anterior mucosal extra redundant mucosal excision as well as posterior mucosal excision, which is the culprit for obstruction of a stool. So this is the main motto of the STAR procedure when it was introduced. So it was introduced for obstructive defecation syndrome only. But later on, once this technique is came or this procedure is came, Dr. Longo himself, many surgeon in India as well as myself also, now we are using this procedure other than the ODS also. So now what are that other procedure? I am using this stapler resection anastomosis, this STAR procedure, when I feel there is a large redundant mucosal prolapse and patient is feeling discomfort about this prolapse, though he has not a ODS symptoms. Okay, but there is a feeling of prolapse. And second thing, the pile surgery, which are mainly we are using a single stapler, the MIPH, but on table we are found there is a large mucosal prolapse. With these piles, I am not doing the MIPH. Instead of that, I am doing the STAR procedure. So the indication of STAR now established is the ODS, but the mucosal prolapse with or without ODS or the piles with the large mucosal prolapse, we or many people or Dr. Longo himself is doing a STAR procedure. As per the statement in many conference with the Dr. Longo, he has converted his MIPA surgery in 95 percentage to the STAR procedure only. Okay. Now, how to do the STAR procedure? Okay, which is very like all the pre-procedure like a dilatation, reverse Trendelenburg position, then CAD, fixation, circular anal device, the fixation over the perianal skin, everything remains same as like a MIPH. Now, and then we are taking a deep bite, 12 o'clock position, a first bite. You can take with the tooth forceps or with the Ellis forceps, was most redundant portion of mucosal prolapse. You take a deep bite with the prolin 20 or the 10 with the one thrust, then pull this thread and take a more deeper bite. Okay, the same bite you have to take at the 2 o'clock position as well as 10 o'clock position. These three suture are the separate long suture. Then after, you have to bind 2 o'clock suture separately with the one thread of 12 suture, and you have to bind 10 o'clock suture with the one thread of 12 o'clock suture. That means that looks like a parachute of threading. So it is known as a parachute suture. After doing this parachute suturing, you most important is to protect the posterior wall. That means there is a tongue retractor available, which are mainly used by the ENT friends. You have to pass this tongue retractor in a space given by the CAD, that is a circular anal device in the posteriorly. But while pushing this tongue retractor, you have to guide its tape. Otherwise, this tongue retractor is going to pierce or perforate the rectal wall. So, before pushing, you have to put your left index finger previously inside the anal canal, then the push the tongue retractor. This is very crucial step for protecting the posterior wall. If you are not protecting the posterior wall, you will get a circumferential stapler, which we do not want, because we are not doing the MIPH. Okay. So after this parachute taking a suture as well as protection of posterior wall with the tongue retractor, the rest everything is like a MIPH. You pull this both the thread from the stapler and the fire. Okay. After this firing, you will get the anterior half donate. It will not be a full donate because you have not taken a few space of a posterior wall. So it will be only the anterior half donate. Then most another crucial step is to identification of breach. Because of this posterior tongue retraction, there will be a breach of only the staple line. You have to identify and cut. So you will get a more two end, a cutted two staple line, end of staple line of first firing, that is a 4 o'clock, or you can end the 8 o'clock position. Same thing, you can take a long thread suture at that bridge dog ear of 4 o'clock and the 10 o'clock, and do the same thing at the 6 o'clock position with the deep two bite of mucosa and the rectal wall. Further, you get the parachute suturing. Now this time you have to put tongue retract at 12 o'clock position to protect the anterior wall. Then you get the fire for this staple, and you will get a half posterior wall donut, but it will be in a continuation of anterior staple line. This time also you will get a breach. You have to identify this breach, you have to cut, and now this dog ear will be a painful, so you have to bury it with the vicryl in a mucosa with the Z suture or the purse string suture. It must be taken buried, because it will be a painful in many times. Okay, now many people want to see a STARR procedure on a video also. I will try to do that, but I have uploaded the anterior STARR in my one video. You can go through that. You can get some more idea or partial idea about that thing, and I will try to put the STARR procedure video in later on. Okay. Now, what is the benefit of this STARR procedure of MIPH? See, MIPH has some problem. That means inadequate donate Second thing, small donut. Third thing, stricture. These all three things will be taken care by the STAR procedure. So then why we are not doing the STAR instead of MIPH? See, sometimes there will be a mild mucosal prolapse which can be controlled with the single stapler only. So every time we do not want, but if there is a no cost the factor of using a two stapler, then there is a no harm of doing STAR in each MIPH case. This is the statement by Dr. Longo himself with the personal discussion as well as in a on stage in many conference. So you can do the STAR procedure anyhow. Now what about my experience? About the my experience, STAR procedure has to know because many partial mucosal prolapse can be dealt with this STAR procedure nowadays with this all the awareness about the obstructive defecation syndrome. The STAR procedure may help to improve this ODS disease. Third thing, it is easier to perform over the MIPH as well as STAR procedure prevent the most complication of MIPH. So definitely I would recommend the STAR procedure to learn, and it is very comparatively very easy and gratifying surgery. Now, about the complication, see, in my practice, I have not seen any complication of myself or even from for others also, or I have not come through that I have a major complication of STAR with my colleague also. There is a definitely some proven or it is on a media or in some group also that STAR may damage may cause rectal perforation, entrapment of bowel as well as vaginal wall fistula, but these all can be prevented, or any surgery may have some the complication definitely may be behind that, but we can prevent with the investigation with the surgical technique. Now, I am giving one controversial complication that in my practice, the most of STAR patients are complaining the perianal itching after 3 months of a surgery. See, this is not proven a complication. Even Dr. Longo, once I have message in the group, Dr. Longo is strongly opposite or strongly banned or strongly even discourage about me that this is not happening in the STAR procedure. Even many senior colleague has denied about this perianal itching complication after the STAR procedure, but I am very much sure about my outcome that most of STAR patients are feeling perianal itching on long term. See, these patients are not chronic use of lubricant. They are not using a xylocaine or any local application. On PR examination or even proctoscopy examination, everything is normal. Fourth, on perianal examination, there won't be any external appearance of like eczema or follicles in this case, which are the common for you can say this may be the cause of perianal itching, but no, these are the all the smooth cases, and there won't be this all problem. So I don't know about the perianal itching cause, but in my practice, yes, I am finding. And if you are doing the STAR procedure, please do follow up about the complication. and we can discuss out according to that thing. Okay, I think this will be a short video about the STAR procedure. I know everyone want to like to see the STAR videos rather than this discussion, but this discussion only matters to know about the basic. I further say what is the most important step of STAR procedure is the CAD fixation. It must be the perianal, and there won't be any appearance of skin inside the seal. We have to see only the pink mucosa after the CAD fixation. This is 2 point. Third point is the protection of posterior wall with the tongue retractor, and fourth is the identification of bridge of a stapler line. These are the most crucial step of a STAR procedure. Okay, thank you. If you have any problem or the queries, please let me know. Thank you very much. Bye.